The healthcare reform is central, I think, to one of the key sets of skills that we bring to the table in the following way. There is an interpretation between hospitals and physicians that need to occur in healthcare reform in terms of being able to deal with risk management. And the two don't understand each other, and we help that bridge because we understand both sides.
Two of the most important drivers in healthcare reform today are around two areas. One is accountability and one is cost or financial. What the public wants is greater accountability for quality of service, for accessibility, for the value, and they want the cost of healthcare to come down. The public really consists today of a convergence of not only the government and the public at large, but also employers, all three of which are requiring a greater accountability of the healthcare system, which means there are physicians, the insurance companies, the hospitals, and other providers of healthcare services. Also in the mix is a greater sense among this expanded public of a desire for greater accountability with regard to the health of a population. In the past, our system has largely been focused on treating illness. A patient presents an illness in the physician's office, and the physician treats the patient for that illness. What employers and the government, and now patients, are wanting is to maintain a healthy person and population as opposed to just treating illness. Well, this requires some effort on the part of the healthcare providers to assist in knowing what really makes up for healthier living. And we've seen all kinds of wellness programs and other kinds of programs aimed at helping people to know how to live healthier lives. The cost benefit of living healthier lives is enormous for all the parties concerned. So what we're seeing is the transitioning of a healthcare system from treating illness to maintaining health of a population.
I think the drivers of healthcare reform is really an intent to try to cover a good portion of the 42 million people in the country that are, uninsured, and then millions more that are underinsured. So I do think one of the drivers of health reform was to ensure that a broader population would have basic health insurance. Well, yeah, let's face it. Before we even have a chance to implement health reform, we already know now that we have many in Washington whose principal commitment is to dismantle what we haven't even yet implemented. So the very serious downside of this is utter confusion out there. What are we really getting ready for? None of us have a crystal ball and know absolutely whether it's HMO, PPO, ACO, exactly what ACO will be, et cetera, et cetera. But I think we can agree on a set of characteristics that we not prepare to meet this particular alphabet soup, so to speak, but rather that we embrace ways of being in terms of how we care for patients, how hospitals and physicians work with one another. We will be more prepared to really respond to whatever ultimately does come out in health reform, and however it continues to redefine itself.
So with healthcare reform, the physicians are in a very difficult position. They are expected to do more with less resources. Well, most physicians that I know are pretty maxed out. So now what? So they're turning to the hospitals for help, and help in managing their practice, help in resources, etc. Well, I hate to say this, and it's a message I do deliver to most all the physicians. I don't foresee anything in the future it's going to make your job any easier. It's going to be harder. Because again, you're going to be expected to do more with less. Now you're teamed up with the hospital, because the hospital's in the same boat as you are. They're going to have to do more with less too. So together, that synergy, it's actually a symbiotic relationship, because one of them can't do without the other, vice versa. And so you have to have a pretty seamless operation to be successful with healthcare reform coming down.
Healthcare reform is changing the way the entire industry works and operates. And I think that's a good thing. I think we need healthcare reform, not necessarily what was passed earlier this year, but there needs to be some healthcare reform. And I think it's going to affect all providers, because there's finally a realization that we can no longer just pay for things that are done without any corresponding expectation for an outcome or corresponding expectation that we got the greatest value for those dollars spent. In healthcare, cost is not really a consideration for most healthcare purchases. And that's going to change, and it's really one of the reasons why we have a cost problem in healthcare today. They're going to need to approach the way they take care of patients differently in the future than they have in the past. Right now, healthcare providers are paid to treat people once they're sick. And there's a new term that you'll start to hear called population management. And what that means is, if you take a group of people, whether they've come in to see you or not, how well, and what are the things that you're doing to keep them healthy? It's a complete paradigm shift in the way you approach treating patients. And so, and I think reimbursement and how they get paid is going to follow that. So it's going to change the way, and it needs to change the way they approach taking care of their patients. And the definition of their patients is going to change. Again, their patients are people who come in now. In the future, it may be just a bunch of people who are assigned to them, whether they've been in there recently or not. So that's going to really create different dynamics in the healthcare industry.
This is something new for physicians and hospitals. Working together, taking risk for the cost of care together in an integrated fashion is now going to be the norm as opposed to the exception. Integrated delivery systems, hospitals and doctors together in a system, have been the exception. There are a few good ones out there and not many. There are going to have to be more and more of them. And there are, in fact, doctors and hospitals coming together all over the country. And so what's going to happen is this. First of all, the resources that are scarce now are going to become scarcer. So doctors and hospitals are going to have to collaborate and figure out how to work together to share resources and lower the overall cost of delivery, or at least certainly lower the trend of increasing costs, because the rate of increase of healthcare prices in America almost always outstrips the gross national product growth, the price index for the consumer price index, and we can't continue that trend. Cannot. So dollars and cents and resources are going to force it, and patients who are now more educated and more informed and more willing to voice discontent with a physician office than ever are demanding it, and are going to demand it even more.